The evidence that repetitive head impacts can cause CTE is strengthened by review. Over the past 17 years, there's been a significant increase in scientific research regarding chronic traumatic encephalopathy. This includes the BU CTE Center. Although some organizations such as the National Hockey League or World Rugby still claim that their sports don't cause CTE or chronic head injury, a review by the leading CTE expert in the world strengthens the case for repetitive head impact, or RHI, which is the main risk factor. CTE was a national issue in the United States in 2007. However, it wasn't until 2016 that the National Institute of Neurological Disorders and the Stroke National Institute of Biomedical Imaging and Bioengineering criteria for neuropathical diagnosis of CTE were published. They were further refined in 2021. To cast doubt on the relationship between RHI and CTE, it has been overemphasized that isolated cases with unusual findings or using non-accepted diagnostic guidelines have been reported. Dr. McKee, Chief of Neuropathology at VA Boston Healthcare Systems and Director of BU CTE Center, points out that more than 600 CTE cases have been reported in international research literature. Over 600 cases have been confirmed to have received RHI through contact or collision sports. CTE has been found in professional amateur athletes. This includes athletes from American, Canadian, and Australian football, rugby union, and rugby leagues. 14 of the CTE cases were attributed to 82%. Although RHI was used for the most recent criteria, the study authors revealed that the families of these CTE cases were not asked about the sports their loved ones played. Researchers found that CTE is extremely rare, even though global efforts have been made to locate it. CTE was found between 0 and 3% of the cases. Where information is available, positive patients were exposed to brain injury or RHI. CTE, however, is the most common diagnosis of neurodegenerative disease in contact and collision sports, athletes, and brain banks all over the globe. She added that the strongest evidence for RHI causing CTE in athletes is the strong dose-response relationship. McKee, the corresponding author of the study, stated that the review shows that the timeline of the development of neuropathological criteria to diagnose CTE. This is nearly 100 years ago. He introduced the term punch drunk to describe a neurological disorder in prize fighters. This review chronologically outlines the numerous studies that were conducted by independent international organizations to determine different populations and find CTE pathology in people with a history of RHI from diverse sources. CTE is distinguished by a unique molecular structure of tauopathy. This is not like the changes seen with aging, Alzheimer's disease, or any other tau protein-related diseases.